Welcome to the podcast, How to Be Well and Strong. I'm your host, Jacqueline Genova, and I'm excited to have you join me as I speak with some of the leading figures in the fields of wellness, integrative medicine, and mental health, as we discover what it truly means to be well and strong in both body and mind. Get ready to be empowered, inspired, and motivated about being an advocate for your own health. Welcome back to another episode, everyone. I am thrilled to be speaking with the incredible Dr. Veronique Desaulniers today about a topic which I am very passionate about, and that is healing breast cancer naturally. Dr. V, welcome to the show. I'm truly honored to have you on. Your book, Healing Breast Cancer Naturally, was one of the first ones that I read to help support my mom on her own cancer journey, and I've been a longtime fan of the incredible work that you do. So I'm truly excited to have you share just a bit of your wisdom and expertise in this area of being able to heal breast cancer with a more natural or integrative approach.
Well, thanks for having me, Jacqueline. I'm honored to be here, and I know you've done some great work, and I know you have a vision of where you want to go with your work and the people you'll inspire. So it's very encouraging to speak with you as well.
Thank you, Dr. V. I appreciate that. So I'd love to start by having you share just a bit about your own cancer journey, which I found so inspiring for our listeners.
Well, 25 years into my role as a chiropractor and a mom, I was in the shower getting ready for work and felt a lump in my left breast. And right away, I knew that it was not just a cystic lump, something in my gut told me. So that was 2004. And it was pretty devastating because here I was, wellness warrior, and I, was teaching my patients to be healthy, and I was doing all the right things. So I thought, ate organic before organic was in style, and had home births and exercise, chiropractic care, supplements, you name it, I was doing it. And here I was facing a lump in my left breast. So I really had to do some soul searching and, go back to the basics. Okay, what allowed cancer to show up in my body? Because I know and understand that cancer is just the tip of the iceberg, right? It's just a symptom. So what were the underlying causes and roots of this cancer? So I asked myself, I literally sat down with a pen and paper and said, okay, what is it going to take for me to reverse this and to get well? And literally it felt like a download. I just started writing, and I realized, nutrition, detoxification, balancing our energy, emotions, all of that. That's how the 7 essentials came to be. And, fast forward several years later, I was sharing my healing journey online. 2012, had no idea what I was doing. Started sharing my journey, and Breast Cancer Conqueror came to be. And here we are 11 years later. And this book is the second edition, Heal Breast Cancer Naturally. Working on a third edition because, I've learned a lot in 11 years of working with women. And I went through a second healing journey, which was even harder than the first. I was, the face of healing breast cancer naturally, and I was overworking myself. I was stressed out. I was coaching women from sun up to sundown. My hormones were off. I wasn't sleeping well. And I created the perfect storm for cancer to show up again. So this time, that was 2015 through 2018. So went through it a second time and really had to take a deeper dive, and learned a lot more than my first journey. So here I am, almost 5 years out, and happier and healthier than I've ever been.
That's often how it happens, and I definitely resonate with what my mom's been through. But you have helped so many women, again, through all of your work. You've been such an inspiration, and your book, I'm telling you, it's sitting on my desk right now, and I have highlighted almost every single page. There's so many markups on it because it's truly such a wealth of information. So I will definitely include that in the link in the show notes as well. And interestingly too, Dr. V, you've spoken quite a bit on the topic of mammography and, alternative screening methods. And I just find it so interesting that the introduction of mammography in the US has been associated with a doubling in the number of early stage breast cancers that are detected each year. Yet the irony is that they were found in a 25-year Canadian study. I think it was around 90,000 women, to not even reduce the breast cancer mortality rate at all. What are your thoughts on that?
Well, that's an interesting, that's a study that I use, that I quote a lot, that Canadian study. Basically, mammography is radiation, right? And I'm not telling anybody out there not to have a mammogram. That's your choice. If you choose to have a mammogram, back it up with an ultrasound or back it up with a thermogram. And if you have a thermogram, get an ultrasound. So, thermography uses radiation and compression. Now, it's been shown, according to the British Journal of Radiation, that increased mammography will increase your risk for breast cancer. And it only makes sense because we know radiation causes cancer. And now with the increase of fibrocystic breasts because of all the environmental estrogens and chemicals and the high sugar content of people's diets, the breasts are becoming much more congested and fibrocystic. So it's like trying to find a polar bear in a snowstorm. Everything looks white. So 48% of the tumors are actually missed in a mammogram with women with fibrocystic breasts. So, as a standalone screening, I'm not fond of it. I've never had a mammogram. I know it's the conventional protocol for most doctors, but I think we're getting wiser with age, and there's so many other tools that we can use to find out if women have breast cancer.
This question goes hand in hand with one of your 7 triggers, which I hope to later dive into. But when we consider the area of medically induced cancers, right? Sometimes I wonder too, Dr. V, if it's even better in some cases for women to not undergo any type of screening, just because I feel like there's been so many cases where women with not very aggressive cancers had biopsies, which caused tumor seeding, or perhaps the fact that the discovery of a small tumor led to unnecessary and very extreme treatments like surgery, chemo, and radiation. And we know that cancer stem cells subjected to radiation and these other chemical poisonings actually stimulate cancer growth and make the cancers more malignant. So hindsight's 2020, right? But I'm just curious, what are your thoughts on that in terms of being able to identify a low grade tumor, not do anything about it?
I think it's important in a sense to know what's going on in your body. So I definitely encourage, breast self exams. That's very key. Checking your inflammatory markers, your vitamin D levels, doing thermography, ultrasound. And if something shows up, then it's an important step for you to ask yourself, okay, what's happening in my body and what do I need to change in my lifestyle to bring my body back to balance? Because if we stay in high stress and inflammation and we don't change our diet, those are triggers for cancer to show up. So I have women ask me all the time, what kind of cancer did you have? Well, I never had a biopsy because to me, a biopsy can break the barrier of the tumor and it does seed and does increase your risk of malignancy. So I chose just to monitor it with other methods. And, it's there 1 year and it's gone the next. So, not everybody can heal their cancer that way. Sometimes some cancers are more aggressive. And for whatever reason, it may not respond to natural methods. And so they do have to rely a little bit on some conventional treatments to slow down the growth, shrink the cancer, but at the same time, always address the root cause of what allowed cancer to show up in the first place.
I love that approach. And I love how you emphasize the fact that breast cancer is not one disease, but a combination of many factors, right? So it's important to truly look at all of those various triggers that you had just mentioned that may stimulate cancer growth in the body. With that framework, could we perhaps at a very high level go through what each of those triggers are?
Well, there's 7 triggers and there's 7 essentials. So, the first trigger is the SAD diet that everybody lives on, the standard American diet. Too much sugar, too many high carbs, and we know that insulin resistance and metabolic inflexibility can be a trigger for oncogenic or cancer-causing pathways. So, look at your diet. Secondly, look at your toxic environment. And especially when it comes to breast cancer, you have to look at all the chemical estrogens you may be exposed to, pesticides, herbicides, plastics, things you put on your skin, things you put under your armpits. All these things have an effect on your body. The third one is looking at the effect that you have on inflammation and methylation, because that can certainly have an effect on how your body processes hormones. Then there's the stress factor and the emotional factor. if we stay in that sympathetic fight or flight mode, we know that that can trigger cancer pathways as well. And cancer cells love adrenaline. They have adrenal receptor sites on their cells. So, we need to bring our body into relaxation mode every day. Then there's dental toxicities. The heavy metals that you have in your mouth, those are what we call xenometallogens. They mimic and stimulate estrogen production in the body. Then you look at the iatrogenic causes, right? The too many CT scans, too many X-rays, unneeded, unnecessary surgeries, things like that. Medications, those things can certainly trigger, cancer. So there's lots of triggers that can affect our body.
And I recently was reading that stress is the most powerful carcinogen imaginable. And if we look at, initial cancer diagnoses, in addition to cancer recurrence, oftentimes the patient's diagnosis is preceded by some type of stressful life event, which I know you've talked about. And that stress hormones can actually act on tumor cells to promote tumor growth and metastasis. So many people do not, again, recognize the importance that managing stress and your emotional state play in healing.
That's so true. And we stress that. We use that a lot. We talk about that a lot in our community. I try to teach our clients and our community how important it is to get into that relaxation response every day, because if you stay in that fight or flight mode, and there was a study published in Nature magazine where your autonomic nerve system, the sympathetic nerve system, the one that keeps you in fight or flight mode, that literally turns on those cancer causing pathways and can lead to the growth of the tumor and metastasis. So there's an 11-year study that was done on women who had breast cancer. It's 11 years. And they found two factors. If they learned to manage their stress, and two, they had community support, they had a 75 decreased risk of dying from breast cancer in those 11 years. So it shows you how powerful two simple things can be, right? Community support, which is why we created community, and managing your stress. I mean, that can't be overemphasized.
What are just some practical tips for those women out there who are always in a fight or flight state, those perfectionist type A personalities? I'm sure you resonate with that, who say, I don't have time for meditation. What are, 2 or 3 strategies that they could just start to implement each day to really bring that stress response down?
Well, I'll speak from experience. My second healing journey definitely taught me that. I've been nose to the grindstone, type A personality, perfectionist my whole life. Women who have breast cancer tend to be that way. And so it's really understanding, number one, understand what the stress is doing to your body, and what is your desire to heal and to really recover, and to really feel the difference between always being the hamster in the wheel, or just being in control of your life. So one of the things that I did is that I remanaged my business and my work. So I assigned the coaching. I trained coaches to do the coaching for me. I cut back on my hours. I literally put in my calendar from whatever time it was, 2 to 3. That was my time to go to my bedroom or go wherever and do my meditation and relaxation. There's so many tools too that you can use. I discovered the Heart Math Inner Balance app, where you clip this little thing on your ear, and there's an app on your phone. It's from the Heart Math Institute. And you can literally measure the sympathetic versus parasympathetic mode of your nerve system through your heart rate variability. And I meditated for years, and I thought I was doing good. But when I put that little clip on my ear, and I saw I was still in the red zone, even though I thought I was in the relaxation mode. So it really helped me to dive deeper into that relaxation and really make that connection. What does my body feel like when I'm really toned down into that parasympathetic mode? So when you feel that, then it's easier for you to recognize, hey, I'm getting in that stress mode. And then there's tools like EFT, journaling, art therapy, music therapy, going for a walk in the woods. There's so many different therapies that can help you to calm down your nerve system. And this is something you must do for yourself, because if you don't, your body will not respond, your immune system will stay sluggish, and you're feeding the cancer if you're staying in the stress zone.
Also, too, you had written about these 7 traits of cancer patients, right? With like having all these different emotional wounds. And I know that being unable to cope adequately with stress, internalizing toxic emotions, being a people pleaser, again, those were all, traits of women who develop breast cancer. So I think that's fascinating. And another question, Dr. V, I have for you is I recently read, I can't recall where, but it said that women who were more likely to develop breast cancer on their right side also tended to deal with feelings of unforgiveness or resentment. Is there any literature, again, on the relationship between emotions and even which side of the body breast cancer would present
Well,
on?
when you look at Oriental medicine, Asian medicine, they look at the body as the left side. The left breast represents the mother side, the mothering side. The right side represents the father side. So if it's on the right side, then there may be issues with your, spousal relationship, or perhaps there's some, daddy issues that were never resolved. Mine was on my left side, and there was definitely some mothering issues, lack of um, nurturing, lack of closeness with my mother. Me being the perfectionist, trying to be the best mother ever. There was just a lot of things involved. So I mean, I see a correlation in our clients between right and left. And when you tell them that, they're like, oh, yeah, that is so spot on. So, but I don't have any specific studies per se.
And also, to Dr. V, so we know that conventional cancer treatments do not directly kill cancer stem cells, right? But they target the daughter cells. Can you touch on the significant role that breast cancer stem cells play, particularly when it comes to recurrence for
Oh, that's such
listeners?
a powerful topic, and it's so ignored by the conventional cancer community. So I discovered breast cancer stem cells during my second healing journey. I had to ask myself, like, what caused this recurrence? I knew the big picture causes, but physiologically in my body, what allowed cancer to show up again? And then I discovered breast cancer stem cells. Breast cancer stem cells are the baby cancer cells that can lay dormant for a long time. But those are also the cancer cells that are responsible for recurrence and for malignancy. So, if you produce the right conditions of that stress, of too much sugar, of toxicity, all those things we talked about, then it can reignite. And chemotherapy and radiation can certainly cause resistive breast cancer stem cells, so that when the cancer shows up a second time, it's even more difficult to heal. Now, the good news is, so when when your conventional doctor tells you, go ring the bell, ding, 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 you're cancer free, we don't use that term in our community. We look at, am I actively cancering? And this is, where I learned this from Dr. Nasha Winters, where she says, I mean, she still has a tumor on her ovary. She had almost died of ovarian cancer 35 years ago, stage 4, sent home to die. But she never removed the tumor. The tumor's still there, but her terrain is not allowing the cancer to grow. And so that's what you have to focus on, is how clean is your terrain? What are you allowing to grow in your body? And so when your doctor tells you you're cancer free, then you must continue to check your inflammatory markers, check your cancer markers, make sure your vitamin D levels are high, follow the 7 essentials lifestyle system. You don't have to be as intense as you were as during your healing journey, but you still want to follow the basic principles, because recurrence is the biggest fear that women have. When women come to our website, I don't want a recurrence, what do I do? That's one of their biggest fears. And so part of our mission is to teach women never fear breast cancer again, because once you understand how cancer works, what it is, what it's not, then you don't have to fear it. You have a large measure of control of how cancer develops in your body.
Absolutely. I couldn't agree more. And Dr. V, I actually had an interview with Dr. Lauren Mathewson a few weeks ago just on that very topic, strengthening the body's internal terrain so that it's as resilient as can be. So I'll also include that in the episode show notes as well. But for a patient who chooses to go the conventional path, are there any things they can do to help mitigate the risk of metastasis? So, for example, I know that modified citrus pectin is an incredible potent natural agent that patients should supplement with, especially prior to any surgeries.
Yes, there's a lot of things. So if we just deal with breast cancer stem cells, high dose melatonin, modified citrus pectin, medicinal mushrooms, making sure your vitamin D levels are high, curcumin, garlic. There's a list of things that will literally, resveratrol will literally kill those breast cancer stem cells.
Follow up to that, I also remember reading that patients can live years and years and years with tumors in their body. We don't necessarily have to remove them. It's just you want to make sure that they don't grow larger or they don't spread. What's your philosophy on that?
My philosophy is, and what I've seen, if the tumor, if we're talking about breast cancer, if the tumor is 2 centimeters or below, chances are, and depending on what type, if it's a HER2 positive, that's more difficult because it's more aggressive. Um, but if it's 2 centimeters and below, chances are you may be able to reduce that tumor load. When it starts getting above that, then you run the risk of immunosuppression because the tumor is releasing a lot of lactic acid, a lot of toxins, and it could really, kind of tip the scales, so to speak. So, there is a time and a place for conventional medicine. So, back in the fall, we just released a new program called How to Survive and Thrive Conquering Breast Cancer with Conventional Treatments and Natural Medicine. And the reason I did this course, and it took 3 years to create the course because of all the research involved, is because 70% of our community, even though they wanted to heal naturally, ended up either having a lumpectomy or surgery or some sort of conventional treatment, but they really in their heart wanted to heal naturally. And then there were women who, for whatever reason, just pressure from the family or pressure from the doctor, chose just to do conventional, but they knew that they needed to address the cause and they wanted to soften the side effects with natural medicine. So we created that course. And so to get back to your question about conventional medicine, yes, there's so many things. And that's what this whole course is about. It's to help women understand that if you do chemotherapy, believe it or not, you can take curcumin, and yes, it'll help with the side effects, but it will also enhance the effects of the chemotherapy and protect your healthy cells. So it'll make it more effective. You
Right.
mentioned modified citrus pectin. This is a must for everyone who's on a healing journey with cancer because it lowers the galactin-3 inflammatory marker and it prevents the seeding and the spread of cancer cells, and it's an excellent heavy metal detoxer. And so there's so many things that women can do, whatever aspect, whether it's surgery, radiation, or chemo. There's ways to prepare your body before, during, and after.
Jumping over to another space that I recently have kind of dived into and find fascinating is the use of off-label
Mm-hmm.
drugs for cancer treatment. So, for example, I came across a
Mm-hmm.
recent study that showed high dose IV vitamin C coupled with doxycycline, which we know is an antibiotic often used for, the treatment of acne, for example, has been shown to actually kill cancer stem
Mm-hmm.
cells. What are your thoughts on using those types of off-label drugs, like again doxycycline, metformin, fenbendazole we've
Mm-hmm.
heard of?
Yeah, there's a place for everything. We're all biologically so unique and so different, and we're all on a healing journey differently. Jane McClellan wrote a fascinating book, How to Stop Cancer, and she had stage 4 cancer twice. And she figured out these cocktails with off-label drugs, like the metformin, like aspirin, like statins, I mean, antibiotics, and it shut down those cancer pathways. So it's very important that whatever path you choose, there's no guilt, there's no shame. It's whatever it takes for your body to heal and recover. That's the most important thing. So many people especially in the healing cancer naturally world, they look down on people who have, do conventional treatments. But trust me, I mean, I've seen women fight tooth and nail. They've been sent home to die. They've been sent to hospice, and they say, chemo or hospice, and they say, okay, I'll do the chemo, and they live. They're around to tell their story. So, it's a matter of really acceptance and combining the two. So the most important thing is that you survive and you thrive after your journey.
You touched on something important too. I mean, in the natural medicine space, there are so many options, right? And it could be incredibly overwhelming for women, again, who are either first diagnosed or experience a recurrence in terms of navigating all of these complementary and alternative therapies. We hear about these clinics in Mexico. What advice do you have for a woman who is so overwhelmed with all of this knowledge and trying to figure out what the most optimal path to pursue is?
Follow the 7 essentials. I mean, that's why I created the program, because that served me. That served my need to make sure that I was checking off all the boxes, because you're right, it's so overwhelming and everybody has an opinion, do this, do that. That's, this is the miracle cure, but you have to get down to the basics. And that's what the 7 essentials addresses. It addresses every root cause that is possible, to make cancer grow. And, find a community, get with a coach, get with an integrative doctor that can guide you. But, the important thing is that, number one, whatever path you choose, is that you have 1,000% belief in what you're doing. If you're getting chemo, don't look at it like it's poison. Look at it like it's healing nectar. I've seen women in our community who didn't lose their hair after they did chemo, because they were so focused on this and grateful for this beautiful chemotherapy that was going to kill the cancer cells. And of course, they did lots of, natural therapies as well. But, there's so many powerful ways to to heal that cancer, so that again, you survive and thrive.
I love that. And that just reminded me, Evilise Page, who I had on a few weeks ago, told me that when she initially started doing her subcutaneous mistletoe injections, she had imagined it as a type of
Hmm.
Pac-Man game where the mistletoe is going inside and just gobbling up those cancer cells. So there's so much to be said again about the power of the mind, and that could be a whole
Yes,
other episode.
definitely.
And Dr. V, so you did mention Dr. Nasha Winters. I know you worked with her for a bit. I'm also a huge fan of her work. Are there any specific dietary recommendations or nutritional strategies that you encourage your patients with active breast cancer to
So
abide
that's
by?
essential number one. Let food be your medicine. And again, we're biologically different, so what works for me may not work for you. I've seen vegetarians come to us not doing well, and we change their diet a bit. We add some protein and modify things a bit, and they do much better. And vice versa. I've seen carnivores and paleo people turn more to more plant based. So there's some excellent tests. One of the tests that I recommend is called the Nutrition Genome Test. It's a DNA test that will look at your genetic weaknesses and SNPs, and tell you what supplements and what foods best support those weaknesses in your body. And so, for example, some of the things that I learned that I don't process vitamin D very well. So I have to supplement with the liposomal vitamin D. I have a methylation issue, so I don't metabolize my hormones well. I have a glutathione issue, so I don't detox well. So, there's a list of things that it can teach you, so you know how to best support your body to function optimally.
Dr. V, this has been wonderful. Again, I want to be conscious of your time. I could spend hours with you, but for listeners certainly who would love to learn more about your work, where can they
So
find you?
breastcancerconqueror.com. We're on Facebook, Instagram.
Wonderful. And my last question for
Okay.
you, Dr. V, is what does being well and strong mean
Oh,
to
I
you?
love that. Well and strong means balanced. It means focused. It means joy, and that you're living a life in a way that's supporting the health and the vitality of your body.
I'm just going to put that as a quote, Dr. V, on my website and just give you credit. That's absolutely beautiful. Well, thank you again so much.
Yeah, you're welcome. Thanks for sharing my message of hope, Jacqueline.
I hope you enjoyed this episode. If you would like to support the show, please subscribe, leave a rating, and share it with others. Be sure to visit WellnStrong.com to access notes from the show and to stay current with new content. I'm so grateful you joined me. Be well and be strong.